We've talked a lot about the different types of respiratory infections common in long-term care facilities, and many are preventable and manageable. So then, what is all the fuss about? The problem is, of the approximately 2 million or so residents with infections in long-term care facilities a year, almost 400,000 of them die every year directly related to infection. When a resident has to be transferred to the hospital, it is usually due to an infection of some sort. Because many residents have cognitive problems like dementia and Alzheimer's disease, they can't always speak for themselves and let you know they are not feeling well. Furthermore, infections are typically not diagnosed or treated until it's too late. If left untreated, the infection can grow out of control and cannot be stopped with medications, which is likely to lead to serious complications and death. The cost estimates for infections in long-term care facilities reaches $2 billion per year. There is also a constant battle to stay ahead of mutating bacteria and viruses with medications that remain effective against infection. Many pharmaceutical companies are challenged with the financial balance between finding new drugs for MDRO and the expenses and time in this area of research. Respiratory infections impact our residents' quality of life, both physiologically and emotionally. The symptoms that have been discussed earlier adds to their daily physical and health challenges. Moreover, pain and difficulty breathing causes anxiety, panic, or fear of dying. Room isolation and social separation during their infectious state adds to their feeling of abandonment or depression. Healthcare workers are at risk of getting infected from the residents. You could be exposed to body substances, contaminated supplies, equipment, environmental surfaces, or direct infected droplets. Anyone who walks through the facility's doors could be exposed, including volunteers, housekeepers, clerical personnel, and visitors. The consequence of you or your family getting sick from this, or the possibility of you losing your job because of too many absences, is not a price you want to pay. Early recognition and reporting of subtle signs and symptoms of respiratory infections could ultimately save a resident's life and others. It is important for you to be proactive in preventing the spread of infections.